Hello everyone. Am I audible? Let me know. Am I audible and visible? Okay. Am I audible properly? Let me know. Am I audible? No. Hello everyone. Welcome to Unacademy Future Doctors. I'm myself Dr. Dipti. I'm MD PhD Physiology and I'm educating MBBS nursing and physiotherapy students. I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription pattern. We have two kinds of subscriptions, one that is plus subscription and other that is iconic subscription. In a plus subscription, you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test and quizzes, and within few months, 12 months, we are coming with our printed notes too. Now, second is our iconic subscription. Here you have access to the best from two of the best, and which are these two? One that is Unacademy and Prep Ladder with Unacademy, in which you have well structured live batches, you have recorded classes which covers your full syllabus, question bank which is having more than 25,000 questions, competitive live test and quizzes, and comprehensive printed and digital notes. And second one, that is Unacademy and Prep Ladder. With Prep Ladder, here you can have clinical and integrated essentials. You can have video lectures from the Dream Team. Question Bank 3 with active guidance, system tags and more. Rapid revision and snapshots and treasures in 2021 Dream Notes. So both are unique in their own. So you can subscribe any of them. You can subscribe from your mobile, either plus or iconic subscription. Longer the duration of subscription, cheaper are the rates. You can use my code DIPTI10 to get 10% extra discount. Okay. Now, we've also added certain special features. Here, you can have interactive live classes. You can attend the live class as well as you can participate in the live chat and get your doubt clear. Also, you can have a facility of raise a hand. You can talk to your educator in live class and get your doubts resolved. Also, you can have poll for the learners too. You can never miss a class as you are always notified for each and every class. Also, you can download lecture notes and get access to recorded sessions of live classes. You can access your classes at any time and anywhere. Next is also we have updated and highly effective question bank, which is having more than 25,000 high yield clinical questions. Now these clinical questions are based on latest exam pattern. This includes detailed explanation too. These are our NEET PG 2021 toppers. Congratulations from Unacademy family. Here we have Unacademy Medical PG test. We have free test rituals in which you can have educator curated test series, FMGE grant test series, study with me YouTube test series, Saturday special class marathon based test series, and grant test series for NEET PG, FMGE, INI and CET. As well as for plus batch test series are, you can have NEET PG 2022 subject wise test series, also NEET PG 2022 grant test series and NEET 2023 system wise test series. Okay. Now we have also started our focus FMGE 2022 comprehensive batch, which was started from 15th December 2021, that is for 6 months, and target NEET PG 2022 test and discussion batch, and this was started from 15th December and it is for 3 months. Okay. Now, so you can subscribe in any of them. And one more thing which I would like to explain you, discuss you, that this on Unacademy Future Doctor channels. All these videos are free to access. Today, as we have completed our respiratory system, so today we will start our discussion regarding MCQs, multiple choice questions most frequently asked from respiratory system. Okay, starting with first one, that is H plus ion more bound to, and your options are, you can write down answers in the comment box also, okay, if you wish. One, that is deoxygenated hemoglobin. Second, oxygenated hemoglobin. C, that is both A and B. And D, not related to oxygenation. And correct option, that is answer A, that is deoxygenated hemoglobin. Okay, deoxygenated hemoglobin binds with H plus, it forms HHB. Okay, when it gets oxygenated, this hemoglobin binds with oxygen, and when hemoglobin binds with oxygen, this H plus ions are released. Okay, this way. So answer is A. Second question, that is, which of the following does not stimulate alveolar hyperventilation? Answers are, A is hypoxia, B, that is hypercapnia, C is acidosis, and D, that is alveolar stretching. Hypoxia, decrease oxygen. Hypercapnia, increase carbon dioxide. Acidosis, H plus ion concentration increases, and alveolar stretching. So here, decrease O2, increase CO2, and increase H plus, all these three stimulate alveolar ventilation. So which will not stimulate? That is alveolar stretching. Okay. Next, so this is your correct answer is D. Next is maximum airway resistance is due to trachea, small sized airway, medium sized airway, and respiratory bronchioles. As it was discussed in theory that medium sized airway, they have large area, surface area, and they provide maximum airway resistance. Okay. Next question, oxygen affinity increases by all except alkalosis, decrease PCO2, hyperthermia, and increase HbF. Now I'll explain. Oxygen affinity increases means oxygen hemoglobin dissociation curve shifts to left. You can see here, this is the curve. Okay, shifts to left and right. Shifts to right for, you can see, increase CO2, increase H plus, decrease oxygen, increase to 3-DPG. In all these conditions, there is shift to right. Shift to right means release of oxygen. Release of oxygen means oxygen affinity decreases. Okay. Now shift to left here, this one. In which condition there is shift to left? Alkalosis. Alkalosis means decrease H plus, shift to left. Shift to left means oxygen affinity increases. Okay. Then decrease PCO2, shift to left. Opposite to all this, increase oxygen, shift to left. HbF, shift to left. So all this they produce here, increased temperature produces shift to right. So oxygen affinity increases by all this except hyperthermia, increase in the temperature, because increase in the temperature causes shift to right, and as there is shift to right, oxygen affinity, when there is shift to right, oxygen affinity decreases, there is release of oxygen. Okay, so answer is C. Then intrapleural pressure, what is the correct answer? Normally equivalent to atmospheric pressure, more positive at the end of deep inspiration, same as intra-alveolar pressure, and is negative to prevent lung collapse. Yesterday we discussed intrapleural pressure is pressure present in the between parietal and visceral pleura, and this is always negative. So this is incorrect, not equal to atmospheric pressure. More positive, incorrect. Same as intra-alveolar pressure, that is also incorrect. It is negative, less than, and is negative to prevent lung collapse. So this is your correct answer, D. Okay. Sixth, in normal adult, ratio of anatomical and physiological dead space is, this is easy question. As we have discussed, anatomical dead space is equal to physiological dead space. So ratio is 1:1. Both must be equal. Okay. Next, ventilation perfusion ratio is maximum in, it is maximum at the apex of lung, middle of the lung, or anybody give answer? That is, or posterior of the left lung and base of the lung. Which is the correct answer? It is elon. This is A. A is correct answer. Good. Why? You can see we have discussed yesterday that at the apex of the lung, ventilation and perfusion both are reduced, so the ratio increases. Normal ventilation is 4 liter, perfusion is 5 liter. Okay, so the ratio is 0.8. When both are reduced, as I told you, ventilation is reduced to, suppose it is reduced to 2 liters, but perfusion is reduced to 1 liter, so the ratio becomes 2. So it is increased at the apex. Okay. Then most potent respiratory stimulator is oxygen, H plus, carbon dioxide, you can also answer, and carbon monoxide. Which is most potent? Anybody? This is carbon. It is carbon dioxide. That is correct answer. Carbon dioxide is the most potent stimulant for the respiration. Okay. Now, next is, next question is, hyperbaric oxygen is used in all except, hyperbaric means with high pressure. Okay, oxygen supply is required in all conditions except, these are your options: congenital heart disease, gas gangrene, carbon monoxide poisoning, and nitrogen toxicity. In gas gangrene, it requires oxygen to give with high pressure. Okay, carbon monoxide poisoning we require with high pressure. Congenital heart disease, I think this is the correct answer because it does not require oxygen with the high pressure. And nitrogen toxicity also requires oxygen with high pressure. So the correct answer is A. Next is FeV1 decreased in chronic bronchitis, pulmonary tuberculosis, fibrosis alveolitis, and bronchogenic carcinoma. FeV1 is always reduced in obstructive lung disease. When there is obstruction, person cannot expire with forceful or with rapidly. He can expire but not rapidly. So that is in chronic bronchitis, which is a type of obstructive lung disease. Okay. None of the other is obstructive lung disease. Okay. Next is here. Cyanosis is common to the patient of anemia. This is easy question. Polycythemia, both and none. Definitely polycythemia, because in anemia, hemoglobin concentration is not enough to show the signs of cyanosis. Okay. Yes. Next is, Air Force pilot is exposed to which of the following forces? Linear accelerative force, linear decelerative force, centrifugal accelerative force, and all of the above. The answer is all, because when the plane is moving, there is accelerative force upward, downward, and when it takes turn, there is centrifugal accelerative force also. So your answer is all of the above. Okay. Then Spot the wrong statement. Positive G causes venous hypertension in the legs. Positive G, hypotension is danger. Negative G causes intracranial hypertension, and none of the above. What would be the answer? Can anybody? Elon, D. Okay, good. So this is, all these three are correct. Positive G, because of positive G means it pulls the blood in the lower limb. So what happens? Venous hypertension in the lung. Okay. With positive G, there is hypotension because all the blood is pulled downward. So there is chance of hypotension in the upper part. So there is hypotension. Negative G, when there is negative G, so that is in opposite. Positive G is in downward direction, negative G is in upward direction. So in negative G, what happens? There is blood is moving in the towards head. So it produces readout and increase in the intracranial hypertension, increase in the intracranial pressure. So that is also correct. So incorrect answer is none of the above. Okay. Next is dissolved of nitrogen in the blood causes DIC, disseminated intravascular coagulation. This will not be caused by nitrogen because there is intravascular coagulation, no role of nitrogen here. Then hemolysis, nitrogen will not cause hemolysis. Narcosis and all of the above. Definitely nitrogen in high amount, it produces symptoms that is known as narcosis. Nitrogen narcosis. Okay. So the answer is C. Body acclimatization to low partial pressure of oxygen produces at high altitude when we are exposed to low PO2. What happens? There is polycythemia, RBC count increases. Yesterday only we discussed in our class. Diffusion capacity increases, vascularity of the tissue increases. So your correct answer is definitely, now you can easily say that it is D. Correct. That is all of the above. Okay. Now, next is ramp signal refers to, we have discussed inspiration, expiration, stop or stop the inspiration, expiration. Ramp we have discussed. Ramp signal that starts beginning slowly, rapidly increase in ramp fashion and abruptly it stops. This is ramp signal. This is for 2 seconds. Here the signal is nothing but the action potential transmitted to the inspiratory muscle. So definitely that is inspiratory signal. And after that for 3 seconds no signal is there. And when there is no signal, there is expiration here. Okay. Then again there is inspiration. Okay. So this is ramp signal. Okay. Now, next is pulmonary J receptors. J receptors are responsible for inspiration, expiration, breathlessness and periodic breathing. We have discussed J receptors are present here. You can see this is the alveolus, this is the blood vessel. In the interstitium we have J receptors. They are stimulated when there is increase in the interstitial fluid. Now, these J receptors, they are responsible for when there is increase in the fluid, they are stimulated and they produce apnea followed by tachypnea and bradycardia and decreased tone of the muscle. So it produces this apnea, breathlessness. This is the correct answer. Okay. Next is commonest symptom of decompression sickness. Decompression sickness is also known as diver's palsy. Decompression sickness. Here the person is having all these are absent. No hypoxia is there, no hemolysis is there. They have joint pain because nitrogen bubbles, that is because nitrogen bubbles, they appear in the motor nerves supplying muscle. So there is joint pain. Okay. So this is answer is A. Then blood flow through the apices of lung occurs during systole, diastole, upright position, all of the above. We have discussed at the apices of lung, zone 2 blood flow, and at the base, zone 3 blood flow. Now, what is this zone 2 blood flow? In zone 2 blood flow, this pulmonary capillary pressure is more than alveolar pressure during systole only. Whereas in zone 3 blood flow, pulmonary capillary pressure is more than alveolar pressure during systole and diastole. Okay. So here the answer is zone 2 blood flow is there at the apices, and here blood flow is during systole only. Okay. Now, next is diffusion capacity for oxygen at rest. When you are at rest, diffusion capacity, how much is it? We have discussed. For oxygen, that is, you must know the value. This is the value from guide 10. Diffusion capacity means amount of gas that diffuses across the membrane. Here for oxygen it is 21 ml per minute per millimeter of mercury, and during exercise it increases 3 times, 65 ml per minute per millimeter of mercury. Okay. Then, so this is answer C. Total surface area for gas exchange in both the lungs. This is also important, easy question. You can easily say, this is answer is, correct answer is 1 meter square, 5 meter square, 15 meter square, or 70 meter square. It is Elon. It is correct. D. You can also answer, anybody else. 70 meter square. 70 square meter, it is equal to tennis board. 70 meter square total surface area. Okay. Then, in which of the following condition oxygen therapy is of greatest value in alleviating hypoxia in peripheral tissue? In which condition oxygen therapy is very much useful? You can see here. Anemia, cyanide poisoning, localized circulatory deficiency, or pulmonary emphysema. In anemia, we can say that we have discussed in hypoxia, anemic hypoxia, oxygen PO2 is normal, but percentage saturation decreases. Cyanide poisoning, tissues are not using, but PO2 normal. Localized circulation, there is lack of circulation, but PO2 is normal here also. But only in pulmonary emphysema, because partial pressure of oxygen is reduced because of less gas exchange. You can see here from alveoli, oxygen is not entering in the blood, so PO2 is reduced. So here we can give oxygen therapy that is having great value. Okay. Now, next is which of the following often has substantial resistance during pulmonary disease state that can limit alveolar ventilation? Means which structure provides highest resistance? Alveoli, bronchioles, large bronchi, or small bronchi? Large and small are not there. We have discussed intermediate size. The intermediate size is not given here. Alveoli are also not. So what is remaining? That is your bronchioles. So bronchioles, they provide highest resistance during pulmonary disease state. Okay. Next is FeV1 to FVC in a normal person. This is also easy question. If you can answer. Can anybody? Normal FeV1 raised to FVC. Can anyone? Answer is brilliant. It is correct. D. Answer is D. 80%. That is correct. We have discussed FeV1 to FVC is 80% of normal. Okay. Then atelectasis occur. Atelectasis means collapse. Collapse occur because of lack of surfactant. That is correct. Obstruction of airway also produces collapse. None of the above is not correct. Both of the above is correct answer. So the correct answer is collapse of lung is because of lack of surfactant and obstruction of airways also. Okay. Expiration is aided by which muscle? We have discussed. For inspiration, the muscles are diaphragm and external intercostal. And for expiration, the muscle is internal intercostal. I told you, if it is I, this is E. If it is E, then it is I. So your answer is internal intercostal muscle. Then cyanide poisoning causes death due to what? Respiratory depression. Issue. You are late today. Hello. Good to see you. Give answers also. Try to solve. It's good. Hello. So, cyanide poisoning causes death due to respiratory depression, brainstem depression, blockage of cytochrome oxidase, and all of the above. What is the correct answer? We have discussed in cyanide poisoning, there is histotoxic hypoxia. So what happens? There is histotoxic tissue, cytochrome oxidase enzymes, they are blocked. Okay. So answer is C, blockage of cytochrome oxidase enzyme. Okay. Then which of the following does not occur as the air passes through the nose? Which does not occur? Warming up, definitely it occurs. Issue, C. Correct answer. Next question, ready for the next. 28. Which of the following does not occur as the air passes through nose? One is warming up, filtration, humidification, and purification. What is the answer? It is Elon. It is D, correct. Warm up will be there, filtration will be there, humidification also will be there, purification will not be there when it passes through the nose. Okay. Next is helium oxygen mixture. Zuhod. Okay, good. Issue, good. A, D. Helium oxygen mixture is used for deep sea diving because it is helium. This we could not complete this topic, but you must have read this. Helium has 1/5 narcotic effect. It dissolves less in the body and diffuses out quickly. Helium keeps the airway resistance at minimum and all of the above. Helium has all the properties, therefore it is used for deep sea diving because less narcotic effect, less dissolved, and keeps the airway resistant. So your answer is D, correct. Issue, correct. D answer. Good, correct. 30. Last 10 question left. Commonest symptoms of decompression sickness, that is joint pain, paralysis, collapse, and coma. This paralysis is less common. Collapse and coma are not the symptoms. Okay. So what is the symptom? Common symptom is joint pain. Okay. Here the answer is joint pain. Okay. Good. Next is 31st. The basic rhythm of good. A answer. Good. Basic rhythm of respiration is generated by neurons located in the medulla. Which of the following limits the duration of inspiration and increases respiratory rate? And the answers are apneustic center, pneumotaxic center, dorsal respiratory group, and ventral respiratory group. What is the answer here? That is pneumotaxic center, correct. Elon, correct. Here we have discussed this medullary centers, they are regulated. We have discussed pons and medulla. We have pneumotaxic center, apneustic center, and DRG, VRG. Okay. So this DRG is regulated by apneustic and pneumotaxic. Why apneustic? And apneustic is regulated by pneumotaxic. So main control is by pneumotaxic center. It is the correct answer. Okay. Now, next is, which of the following gas is used to estimate diffusion capacity of the lungs? Lungs, it is lungs. So maybe the spelling is wrong. Carbon dioxide, carbon monoxide, cyanide and nitrogen. We have discussed carbon monoxide is the gas which is used to measure, to estimate the diffusion capacity. Why? Because carbon monoxide can easily binds with hemoglobin. So pulmonary capillary pressure of carbon monoxide is 0. So it can be easily measured because it is 0. So if we are knowing alveolar carbon monoxide, then we can measure the diffusion capacity. Okay. So this is the reason why carbon monoxide is used. Okay. Issue. B. Correct. 33. Pulmonary wedge pressure is used to monitor which pressure? Left atrial pressure, left ventricular pressure, pulmonary capillary pressure, and pulmonary artery systolic pressure. This is, is it left ventricular pressure? Atrial? Elon, it is wrong. Left ventricular, it is not left ventricular. It is left atrial pressure. How we will discuss, you can see. Here is our, suppose, schematic diagram of heart. This is left atrium, right ventricle, left ventricle. Okay. So here you can see this right atrium receives blood from superior inferior vena cava. This is going to the pulmonary artery. So pulmonary wedge pressure, for that what we do is, and here from lungs the blood will come through pulmonary artery to the left atrium. So for that what we do is, we are placing catheter here. From this way it will reach to the pulmonary artery. Issue not understanding, I will explain. Let me explain again, just a minute. You can see, suppose left atrial. How left atrial? I'll explain. Because pulmonary wedge pressure, for that what we do is, we are placing catheter in the pulmonary artery, and pulmonary artery, from pulmonary artery blood will be going to left atrium. So if we are placing catheter here, which pressure we can measure? We can measure left atrial pressure. Am I clear? Okay. Okay. Next is, healthy 45-year-old man is reading newspaper, just sitting quietly. Which of the following muscles are used for quiet breathing? Diaphragm, external intercostal, internal intercostal, and scalene. It is easy question. That is muscles of inspiration. They are diaphragm and external intercostal. But main muscle which is responsible for 70 to 80% of breathing, that is your diaphragm. So here the correct answer is diaphragm. External intercostal is also not required when we are sitting quietly. Okay, correct. Issue A answer, correct. 35. What is Heldon's effect? Heldon's effect we have discussed, that is in lungs. In lungs what happens? Oxygen binds with hemoglobin. Okay, and when oxygen binds with hemoglobin, what happens? Carbon dioxide is released. Now find out the answer. Binding of CO2 with hemoglobin displaces oxygen, binding of oxygen displaces CO2, binding of carbon dioxide displaces oxygen, and binding of hydrogen with hemoglobin displaces oxygen. This is my explanation first. Now you can easily find out the answer. That is, the answer is, oh sorry Elon, it is wrong. Not A, it is B. Binding of oxygen with hemoglobin displaces carbon dioxide. As I told you, in lungs oxygen binds with hemoglobin and carbon dioxide is release. So answer is B. Okay. Next is, person has dead space volume 150 ml, tidal volume 450 ml, and respiratory rate is 20 breaths. What is alveolar ventilation? 5 liters, 6 liters, 10 liters, 15 liters. Let us calculate. Alveolar ventilation is equal to tidal volume minus dead space volume multiplied by respiratory rate. Tidal volume 450 minus 150 into 20. That is 300 multiplied by 20, and the answer is 6 liters per minute. Okay. So the answer is B. Okay. Next is functional residual capacity. What is it? We have already discussed. Volume remaining after forceful expiration. This is our residual volume. Volume remaining in the lungs after normal expiration. This is our B. Correct issue. Here also B. Tidal volume plus volume inspired forcefully. What is this? This is inspiratory capacity. Tidal volume plus volume expired forcefully, that is expiratory capacity. So here also our answer is B. Okay. 39. Volume of air taken in and given out with forceful expiration is referred as, we have discussed. Suppose somebody is taking air forcefully. So he is feeling tidal volume plus IRV volume. Then when the person is expiring forcefully, okay, so he is expiring IRV, tidal volume and ERV. So it is equal to IRV plus tidal volume plus ERV is equal to vital capacity. So the answer is vital capacity. Now here the answer is vital capacity. Okay. Last question. Regarding pulmonary function test, all are true except total lung volume increases in emphysema. In emphysema, because the alveolar septa is destroyed, so volume increases. This is correct. Compliance decreases in interstitial lung disease. Distensibility decreases. This is also correct. Compliance is total lung distensibility. This is also correct. FEV1 is forced expiratory rate in 1 minute. What is FEV1? Forced expiratory volume in 1 second. So this is not correct. So incorrect answer, that is D. Okay. So this is about our today's session. If you have any doubt, you are most welcome. Tomorrow we will take some lectures which are left of CNS. Tomorrow we will take cerebrum. So be attentive. Okay. Cerebrum, that is also one of the important part in your neuroanatomy. Okay. Issue. Okay. Good. Issue, Elon. Okay. Good. Good to see you all. Who is else is present not giving answer? This brilliant class. Zuhog. Okay. Okay. Goodbye. Thank you all. Thanks for watching. If you like my video, you can like, you can share with your friends and subscribe our channel.